coronavirus outbreak to the shortage of nurses in South Carolina schools, I speak exclusively with State Representative Krystle Matthews for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. State Representative Krystle Matthews, welcome back to Quintin's Close-Ups.
Hi, Quinn. Thanks for having me back. Glad to be here.
All right, I appreciate it greatly. Obviously, I have to jump into some developing news. As you know, Governor McMaster recently said on Twitter, quote, "We must give our parents the choice in how they want their children educated, whether that is sending them back to school for in-person learning or keeping them home for virtual learning. They should be able to make that choice with confidence." Let me ask you this, Representative Matthews. What choice do you have the most confidence in right now?
Right now, the choice I have the most confidence is going virtual. I have 5 children myself here at home, and they will all be going virtual, at least until we get to a point where I am confident in the school's ability to actually execute a safe reopening. We have seen already in so many neighboring states where they've tried to reopen, and it's just kind of spread like wildfire. There's many things that we still don't know about the spread of coronavirus. And for me, I feel like that is far too dangerous of a situation to put our children and our teachers in.
And let me ask you this, what are the unknown factors right now?
Right now, we really don't know how it spreads. There's been, of course, a lot of speculation over the last 6 months about whether it stays on surfaces and how it's transferred from person to person. But I, as well as others, know plenty of people who have been very careful, who have still contracted coronavirus. So that to me says there are still a lot of unknown factors about how it is actually spread. And we have schools that are ready to reopen and they don't even have soap in the dispensers. They still don't have the proper PPE delivered to the schools. And we're just rushing this thing forward without a thought about how the teachers are going to feel. The teachers are parents just like we're parents. And if they don't get a decision, then we get a decision that affects them. I think there's a lot of factors going on that we need to make sure we're aware of before we just jump into this knee deep.
Now, how many schools in your district don't have PPE right now?
I don't know how many don't have PPE because I think it's a rollout plan. They're just staffing, supplying the schools as they get it in. When we talked to Molly Spearman a few weeks ago, she said that some of it is going directly to the districts, some of it is going to a warehouse, and then they're distributing it to the districts. But they're supposed to have it before school starts for everybody. And as we know, school has already started for some districts on a rolling schedule. So that was another thing that, as a state rep, I felt was like a bad decision to do a rolling start. I thought everybody should start on the same day. It feels a little chaotic to try and keep track of which district starts on which day, and then trying to help parents navigate through, barriers and hurdles, such as just access to information about, what do we do? Where do we go? Is there a procedure? A lot of these things are questions that we have to answer. And with having so many chopped up dates, it can be arduous.
Now, what date would have been ideal? After Labor Day?
Yes, I think everybody should have started on September 8th. I think that would have been a really clean start, easy for everybody to kind of get on board with. But even saying that, I would encourage anyone who has the ability to keep your children home, I would encourage you to do so. I think it makes it safer for those that have to go, those that need to go. The more of us that are populated in an area, I think the more at risk we put the others. And there are some of us who do have the flexibility and ability to stay home. And I think that would help mitigate as well. These teachers, obviously, this is their profession and they don't get really much of a choice. I think a lot of school districts did surveys to find out who preferred what over what. And I'm not sure if they let the teachers' decision lead or the parents. And I think they tried to do a combined effort. But if you can keep your children home, I think it would make it safer for those who are forced to return.
And I'm going to get back to that in just a few minutes. But let me ask you this, and this is coming from the Postal Courier. Many South Carolina schools may be dealing with the pandemic without a full-time nurse. School districts across the state are scrambling to hire nurses, a necessity as classrooms reopen amid a pandemic, but they're competing against each other as well as hospitals that pay much more. How much is the state willing to pay, and how much is this going to cost the average taxpayer?
That I don't have an answer to. I have been told that was also another question asked by asked to Molly Spearman on our call, and she did say that they are actively taking a stock of how many schools have a full-time nurse. Some of the more rural communities share a nurse that kind of travels back like a floater as needed, and they're trying to assess how many they actually need. She was not able to provide us with a number. I was told that under the CARES Act funding, they can use funding from CARES Act to actually hire school nurses. And we asked her, is she making sure that these districts know that that is an allowable use for the money so that we can make sure that we do have a full-time nurse in every building? But also, once again, going back to why we don't need to rush into this. We control. So the school year is it's a mirage of days, right? You got to have I think it's 120 days of instruction for a minimum of 6.5 hours a day or something like that. There are parameters, right? But it doesn't say when it has to start or when it has to end. So I think that for me, I feel like we're rushing something that we have the power to control and make sure we have everything we need in place before we go back.
Well, let me ask you this, State Representative. Should public schools have the option for a hybrid model to accommodate social distancing?
Elementary schools and these lower grade schools start functioning more like college campuses. I thought they should utilize the city at full capacity for larger venues and places where the children can spread out and where they can have more room. And the teachers may be able to even make the group larger, but have a combined effort where you have more than one teacher in a situation to facilitate the class size, almost very much like college level, but at a younger age. I thought that would be smart use of city resources, but I'm not on the education committee. So.
Right. And how much does hospitals pay more when it comes to nurses?
I have no idea. I do not know the pay scale for hospitals. I'm sorry.
No worries. And let me go on to that Post and Courier article as it reads here. As of late May, about 130 schools had no nurse on campus, and an additional 75, as you mentioned, shared a nurse with another school, according to a survey by the State Department of Education. How many nurses are needed right now in your district?
I don't know that answer. We were not given an answer. They were still surveying when we were asking these questions, and that was not that long ago. So, unfortunately, I can't tell you how many. But again, right,
Yes,
we're getting ready to start school in a couple weeks, and we didn't have a solid answer when we asked her on the call how many we were short. So, again, all of these things that I don't have answers to are highlighting all the more the reason why we should not be rushing back into school start. Yes, we should start school, but what are we rushing into the start of school for? And additionally, I would like to address the question as well from another perspective. Okay. When you talk about the lack of nurses and the lack of things that the posting, that you're referring to years and years of underfunded education from the state of South Carolina. So all the coronavirus pandemic has done is exacerbate a situation that was already there. I am baffled at how people think you can throw the ball over the fence repeatedly and never have to take responsibility for it. I am baffled by that. I'm mesmerized. And these legislators will tell you, oh, well, we're doing a good job, or we're not doing a good job. We are not doing justice to the state. We can do better. We have the ability to do better. We need and should do better. It's ridiculous.
And State Representative, let me ask you this. How many full-time nurses were there in your district prior to this outbreak?
I don't know the exact number of nurses, Quintin, for the number of nurses. Prior, before, during, that is just not information that I would readily need to know unless something happened in the district, and it's just a lot of information for me as a legislator to have to know the details of how many nurses we have, because a lot of the hiring and stuff that goes on, the state gives the responsibility to the school districts to manage. So that would be a question probably better posed for superintendent. He would probably know better. Dr. Ingram would know better for
Right.
Berkeley County, and Dr. Postaway for Charleston
Right.
County, because I do represent both districts, both
But
counties.
they won't,
Sorry.
or they won't let me interview Dr. Postaway, so that's not going to happen. But let me ask you this: Tess, I asked too many tough
She
questions, I
is
guess.
seemingly unavailable to those of us who have tough questions. So that is very funny. And what's even funnier is that they like to use her as an example, and yet we still have schools in Charleston County that do not have correct PPE. I am also amazed, but then again, there are friendships, and they make you question that as well. So,
And what should be the correct PPE in these schools right now?
I think every district is kind of set up differently, but I think we need to make sure teachers have access to masks, gloves if they'd like them, shields, sanitizer, antibacterial soap. We need all kind of things, non-touch surfaces. If I were running this thing, we would have, in Boeing where I work,
Right.
we have the bathroom doors that you wave open. You don't ever have to touch a handle or a knob. There's a sensor, and you wave and it opens.
Right.
You don't ever have to touch it.
Wow.
That is kind of where we need to move to as a society because of all of this. It's just showing us again what we have been lacking in, that we weren't paying attention to, that we have decided to ignore. And here it is now, right in our faces, right back again.
And let me expand on the COVID-19 situation. Let me ask you this, State Representative Matthews: testing versus infection. How many testing cases are there in your district, and how many are actually infection cases?
Okay, so there are hundreds, and we get a daily report. We haven't got the report for today yet because it's still early in the day. But we get a daily report, and on a weekly average, there are hundreds. I mean, so it might be 19 a day, and half of them might be positive, right? But I want to say something about the testing. People keep saying, well, the reason why the cases are going up is because there is more testing. Well, that's probably not entirely true. People are more active. When he lifted the state of emergency, it forced a lot of people back to work. It forced a lot of things to reopen up, right? Businesses can't survive when they're closed. So they have to open up to try to make money for survival, right? So people are a lot more active and going around. And I think just as a general rule, we as Americans, we're spoiled. We can't stand to be without our inconveniences for more than like a couple minutes before we start throwing baby hissy fits about being uncomfortable, right? And then people go out, they get comfortable, they let their guard down, right? You see people walking with their mask under their chin, touching a lot of hot spots, door knobs, and things like that without washing or sanitizing. Where in the beginning, everybody was feverish about doing it, right? Sanitizer, you see them out in public, they got sanitizer, they got gloves on, and now it's dwindling away. It's slowly fading away. And I think that is why we will continue to have the problem that we have with the spread. And I can only imagine with the start of going back to school, these kids, kids are notorious for carrying germs. So just imagine what they're going to do with COVID.
And obviously,
it's scary.
And that's what a lot of people are telling me. And I know, obviously, I interviewed State Senator Marlon Kimpson on Monday. And just 2 weeks ago, I interviewed State Representative Russell Ott out of Orangeburg and Calhoun and Richland counties. And they both agreed that the governor should have issued a statewide mask mandate. Where are you in this discussion?
Yeah, I agree. When he came out, he should have came out strong and hard. The problem with our governor is that he doesn't like to lead. He's more of a follower. I need him to come out strong leading. We can't wait to see. When people are looking to you for direction, you can't wait to see. It's better to err on the side of caution than it is to risk lives. And if I hear one more Republican say, it's only been this many deaths, I'm going to scream. One death is too many. If it's your family member, Quintin, is one death too many? Yes, it is. If it's my family member, is one death too many? Yes, it is. These people that are dying are not just numbers. They mean something to somebody. You can't just say, oh, well, less than 3% of the people died. Whatever percentage of people died, they belong to somebody who loved them. You agree?
I can't, yeah, I just
I'm
try to
sorry.
be, oh, no
But
worries, no
I
worries.
got you. But they belong to somebody who loved them. So you can't say that there's only this many percent that die, or that it's only elderly people that die. They still have people who love them. That is just a crazy mentality to walk around and have. It just makes no sense to me.
And let me ask you this, ironically, what's the average age of people in your district with infection? And is that average getting lower?
Honestly, we have such a wide range in this district. I would say, but the average age in this district is between 30 and 60 something. Um, our numbers are going down though. Berkeley County has done really, really well at controlling their numbers. Anyway, from the start, Charleston County, not so much. But then again, I don't know how many of those cases are from actual residents, because we're still seeing so many people visiting Charleston County, irregardless of COVID. So when you say people that got tested in the county, that the way the testing sites are working, it may not be people who actually even live in that county, but come there to get tested if there's a site testing that day. So I think that a lot of it is really just willingness to be cautious, but the numbers in Berkeley County have most certainly been lower. And I attribute a lot of that to the fact that we're not necessarily a hot spot for shopping and activities and things like that, versus Charleston County, which is more of a hot spot for visitors, tourists, and people moving around.
And for those who are actually hospitalized for other cases, how many are actually tested positive for COVID in your district?
I have no idea. I do not keep track of the hospitalization numbers.
And are there any overcount or undercount cases of COVID in your district?
I don't know of any, but I have been hearing that people are a lot skeptical about whether people are being coded correctly under COVID when they go to the hospital, or, so I guess there could be a possibility of an overcount. I like to think that our medical professionals are being functioning with the highest regard of integrity and not doing that by padding the numbers. But I definitely think people are skeptical of that. I personally, I am holding hope that they are acting with the highest level of integrity, and of not, of course, over making the numbers bigger than what they are.
And when you look at DHEC and you look at those numbers for the public health lab backlog, and what results are you looking for?
I am looking for new cases. I would like to see where the hot spots are, where the new cases are. And a lot of times it is in those high touristy areas, which leads me to believe that moving around more, of course, spreads it more, which is why I try to keep me and my family home as much as possible and not really go out unless we need to. And if we do, just being safe, having, sanitizer. My purse has now become a first aid kit for sanitizer, extra mask, everything that you need to kind of wipe down after you leave a place or go into a place. So I think that we have to look at the data and really listen to what it's telling us, which is the more you move, the more it spreads.
Let me ask you this too, Representative Matthews. With the COVID situation affecting the state economy so badly, how has it affected sales tax revenues in your district that are needed for projects such as transportation?
I don't have a direct answer for that. You said sales tax revenues so the transportation money, right. A lot of it comes from the state.
Right.
We go back in a couple weeks to really look at the budget and things like that. We know that a lot of the surplus that we had will be eaten up by a lot of what we had to do for COVID. But with the money that we also receive federally to help out, I still think we should be able to sustain a baseline of some of these projects. I don't know that we'll actually know the impact until COVID has kind of started to clear up. I think then, because we're actually still spending money now, it's hard to say what you're losing in the middle of still spending. That makes sense?
And you talk about that budget. Let me talk to you about unemployment. How much money is there available for that for the people who are still, unemployed? Some people who've lost their benefits because they ran out of, money for, the 13 weeks. What's the solution?
I think that they should extend for people who have lost their jobs, but outside of that, I feel like we should have put in stipulations to protect people's jobs from COVID issues. When we were under the state of emergency, that added a extra layer of protection. But once we came out of that, now people are forced to return to work no matter what their situations are, and there's no protections for them should something arise. Now, is it in employers' best interest to try and work with employees that are tested positive or have other things going on related to COVID? It would be in their best interest, but there's also nothing guaranteeing this. Excuse me. I think a lot of people who apply for unemployment and things, there are still some people who haven't received unemployment benefits that applied since the beginning. Still trying to work through barriers and difficulties. I know I have. DEW has been working pretty well with us to try and work through a lot of these issues. So I really do think that we need to extend the help that we're offering people because of COVID, if there's truly a need for that based on things and barriers that have come through COVID.
And how soon do you want Governor McMaster to accept the money from the federal government as far as adding on more money to the weekly unemployment insurance?
Like now, I received like 100 emails yesterday about from constituents that are saying they want this money. Yeah, that they need this money. I mean, the stories behind why they need it, the stories behind what's happening, and I actually do try to read through those emails and see what they're saying. And I received a ton of emails saying to encourage him to accept this money. And as the representative of the people, this is not a hard decision for me because I represent the people. And if the people are saying that, look, this is something we need, then who am I to stand in the way of that and create a barrier? I definitely support meeting the needs of the people ahead of everything else.
State Representative Krystle Matthews, thank you so much for your time. And again, welcome back to Quintin's Close-Ups.
Thank you. Thank you for having me.
You're very welcome. You're all welcome.